Have you ever heard of mineral that was first discovered because it poisoned animals but today is considered essential for human life? Yes, it is the mineral that is the selenium. Selenium protects our cells from oxidative damage, supports our thyroid hormone activation, improves immunity, and even helps prevent muscle damage. But remember, too little selenium causes deficiency, while too much causes toxicity called selenosis. In this video, we will cover selenium for MBBS exam point of view. First, introduction, RDA, sources, deficiency, toxicity, biochemical functions. Let's begin. The selenium is essential trace element for our body, and interestingly it was originally identified as element causing toxicity in animals. Later, scientists discovered that in very small amounts it is biologically important and essential for our life. So always remember, small amount is essential and large amount is toxic. The recommended daily allowance is approximately 50 to 200 milligram per day. Remember, it is in micrograms, not milligrams. It's the milligrams, not micrograms. The best dietary sources include organ meats, that liver and kidney, and seafood. These are the selenium rich foods. Now let's discuss the deficiency. Deficiency causes muscular dystrophy, pancreatic fibrosis, reproductive disorders. This occurs because the selenium normally protects muscles from the oxidative damage. Deficiency in humans, there are the two important diseases. First one is Keshan Disease. This is the endemic cardiomyopathy, meaning that the heart muscle undergoes multifocal necrosis. The result is heart failure and cardiac dysfunction. It is mainly due to selenium deficiency. Low serum selenium levels are also associated with the increased risk of cardiovascular disease and certain cancers. Exam point of view, Keshan disease, that is the selenium deficiency plus cardiomyopathy. Second one is the Kashin-Beck disease. This is the osteoarthropathy. It is characterized by degeneration of cartilage, necrosis of joints, growth abnormalities. It is associated with selenium deficiency and mycotoxins. Most commonly seen in children between 5 to 15 years. Kashin-Beck is bone and joints, and Keshan is related to heart. Excess selenium intake causes selenosis. Clinical manifestations include weight loss, emotional disturbances, diarrhea, hair loss, garlic odor in breath. Why garlic smell? Because the formation of dimethyl selenide, which is excreted through breath. This is another favorite Viva question. Now the most important part, the functions. First, works with vitamin E. They prevent muscular dystrophy, hepatic necrosis. Together, they protect cell membranes. Remember, vitamin E plus selenium prevents the development of muscular dystrophy and hepatic necrosis. That is a powerful antioxidant pair. Selenium helps to maintain structural integrity of the biological membranes. This protects cells from the oxidative damage. Third one is this is most important function, that selenium is present as selenocysteine in enzymes, that is the glutathione peroxidase. It converts harmful hydrogen peroxide into harmless products, thus protecting cells from the oxidative stress. Which trace element is present in glutathione peroxidase? That is the selenium. Free radicals attacks membrane lipids. Selenium prevents the lipid peroxidation. Therefore, all cell membranes remain intact. Fifth one is thioredoxin reductase, that is the selenium present in the thioredoxin reductase enzyme. This enzyme participates in DNA synthesis, purine nucleotide metabolism, and cellular redox reactions. Sixth one is protection against carcinogens. Selenium protects tissues against carcinogenic chemicals. This antioxidant property reduces cellular injury. Seventh one is the protection against heavy metals. Selenium binds the toxic heavy metals such as the mercury and cadmium, and decreases the toxic effects. It's the very important function that activation of thyroid hormone. T4 is converted into active hormone T3 by the enzyme 5-deiodinase. This enzyme requires selenium. Without selenium, T4 cannot be efficiently converted into T4. This is the frequently asked MBBS question. Let's revise quickly. Selenium is essential trace element and its RDA is 50 to 200 microgram per milligram per day. Sources: liver, kidney, seafood. Deficiency in animals: muscular dystrophy, pancreatic fibrosis, Keshan Disease that is related to cardiomyopathy, Kashin-Beck Disease related to osteoarthropathy, Toxicity that's called Selenosis, garlic breath because of the dimethylselenide present in Glutathione Peroxidase enzyme, then prevents lipid peroxidation, component of thyroidoxin reductase, another enzyme, protects against carcinogens and heavy metals, converts T4 into T3 via 5-deiodinase. So that's the selenium explained in the easiest MBBS style. If this video helped you understand the topic, make sure to like, subscribe and share it with your classmates. In the next video, we will see another high yield trace element. Thank you for watching.